Now the second chakra.
Yeah, yeah,
Once the thyroid tablet is given,
yeah, yeah.
can we stop it?
Right. So if it is autoimmune hypothyroidism, then most likely we won't be able to stop it because, yeah, I mean, even practically we have seen, like, when at subclinical stage, like when the TSH was at 5 or 6, and the child had presented with a goiter with positive anti-thyroperoxidase antibodies, and the treatment was advised, but the parents felt like, okay, like, let us not, like, start it now. But they came back again after 3 to 4 months time when the TSH like elevated to more than 10. So in autoimmune hypothyroidism, it's going to progress.
Okay.
So if the autoimmune antibodies are positive, then most likely chances we may not be able to stop the
Stop it.
thyroxine ever. But if the autoimmune antibodies are negative, then probably the thyroid functions itself are going to speak for themselves.
Mhm.
So if probably the child is on a very minimal dose, 12.5 or 25, and if his TSH is in the normal range, then we won't be able to stop it. But if the TSH is suppressed, it's coming like below 0.5,
Okay.
and then we can taper and we can see.
Okay. So my question would be, so autoimmune is lifelong.
Yes,
We
autoimmune is
cannot stop
lifelong.
it.
We
It
cannot
keeps
stop.
antibodies keep coming on. There's no
Yes.
way we can neutralize it. No way we
Yes,
can
yes,
stop it.
yes.
Right.
There is no treatment
No
to
treatment.
treat the antibodies, per
Antibodies.
se.
Right.
Correct.
So normal acquired hypothyroidism.
Yeah,
Otherwise,
yeah,
based on their TSH level, you'll
yeah.
take a call.
Yes.
Right.
Yes,
If it is going
yes.
below, then he's on minimum medication. You
Correct.
can take
You
a call.
yeah,
So there's
yeah,
something
yeah.
positive and hope for the patient,
Correct.
both the ways.
Yes, yes.
Because height is a concern.
Correct.
So few parents, because the concern again starts.
Yeah,
Right?
yeah.
They read a lot on social media. So mine is now asking as a parent, not as a doctor,
Okay.
because it's an information which is,
Yes.
there are a lot of things which I've gone through. You can
Okay.
just update me,
Yeah.
like, doing yoga, eating only vegetarian, completely turning vegan.
Yeah,
Right, say that inflammation decreases in the body,
Correct,
that decreases the antibodies, so the
Right,
autoimmune
right.
responses go down. So we
Yes.
outgrow thyroid without any
Yeah,
medication.
yeah.
Lifestyle modifications, as I've
Yes,
rightly said.
yes.
Hydrotherapy,
Right.
drinking lots of water, that
Yeah,
also
yeah.
helps in maintaining hypothyroid
Correct,
levels. So there are a lot of things people work on, because parents work on,
Yes.
thinking that this is something where I have to stop my child from taking a thyroid
Taking the
tablet.
medication, yeah.
So your
yeah,
views,
yeah.
general views on it, because this
Yeah,
question
yeah.
I'm asking as a parent. Hydrotherapy,
Correct.
vegan, turning
Yes,
vegan,
yes.
understood?
Yes.
Lifestyle modifications,
Correct,
doing
correct,
yoga, decreasing the stress responses.
Yeah, yeah.
Does it play an impact as far as your management of hypothyroidism concerned?
Right. So all these factors may help in probably promoting the thyroid health,
Mhm.
but they are not a replacement for the medication.
Okay.
Right. And definitely, like, I mean, I don't want to undermine yoga or like even the healthy lifestyle choices, but turning vegan, I would say, because there are no scientific studies established to say that turning vegan could treat the thyroid problems.
True.
So I think because out there in the Google there is lot of
information, because
lot
I'll
of
tell you where it
information.
comes from.
Yes,
They say that
yes.
eat a non-vegetarian diet, it causes a lot of inflammation in the
Yeah,
body,
yeah,
it causes a
yeah.
lot of antibodies.
Correct.
That itself will be hitting our thyroid.
Yes,
This
yes,
is where it comes
yes,
from.
yes,
They say you
yes.
reduce that, automatically your
Correct,
inflammation goes down.
Correct.
So I get your bottom
Yes,
line.
scientifically, like, there is no
problem.
proven.
So what your point is,
Yeah.
by doing all this is good
Yeah,
for
yeah,
the child,
yes,
because
yes.
overall health will become
Yes,
better.
yes,
Definitely
yes.
will become more smarter,
Yeah,
more,
yeah.
and his probability of increasing medication
Correct,
for
correct.
thyroid might be very
Might be,
less. He might be on a very minimum medication
Minimum
for a longer
medication.
duration
Yeah,
of time,
yeah,
which
yeah.
itself is a good thing.
Good thing, yes.
So all these things are good.
Yes,
Drinking
yes.
good water is good.
Good.
Doing yoga is good.
Yes,
Having a
yes.
stress-free life is extremely good.
Extremely
So
important.
the probability
Yeah,
of this
yeah.
person having future problems.
Yes,
See,
that will be lessened.
the concern
Yeah,
here for
yeah,
me is
yeah.
the thyroid, if
Yeah.
it is not managed well in a
Correct.
child or in
Yes,
any age,
yes,
will
yes.
also lead to diabetes,
Yes.
will also lead to hypertension, will
Correct.
also lead to other problems, because every
Yes.
hormone has a connection with another gland.
Other hormones.
So
yeah,
if we manage our lifestyle, discipline our lifestyle, the
yeah.
probability of us getting it
other
automatically
problems
goes down.
reduces.
So you'll
Yes,
become actually
yes.
more smarter, stronger, and
Yes,
leaner.
yes,
Right.
yeah,
So that is a
yeah,
probability,
correct.
because you're adding a good thing to your
Good.
life.
Yeah.
So
yeah,
sometimes
yeah.
you become really better
Yes.
compared to what you were.
Correct.
Because
Correct.
I think that is something I
Yeah.
got it as far
Yeah,
as a thyroid
yeah,
disorder is
yeah.
concerned. So there is nothing called
Yeah.
stopping medication.
Stopping medication.